Welcome back. I'm here with Michael Myers, the Managing Director of the Rockefeller Foundation. Thank you so much for joining me, Michael.
Glad to be here.
What does a resilient and responsive health system mean to you?
Well, we all know what a strong health system looks like. It has its clinics, it has its health professionals, it has its laboratories, but a resilient health system is one that stitches that all together. So it's a true system. It's a living, breathing organism of sorts that can adapt and adjust in times of crisis. So it's those soft qualities, building trust, communication, that really distinguish a resilient health system from just a strong health system.
What actions do you think that HSG, its members and partners, and the Rockefeller Foundation specifically can undertake to make systems more resilient and responsive?
Step one is defining what a resilient health system is. We're all, since the Ebola crisis in West Africa, thinking about what the qualities are. And we've come down to, is it aware? Can it adapt? Is it diverse, able to respond to a variety of threats? So they're the qualities, but now we need to define what measurements are on the ground to know whether a system is resilient or not. And that's the challenge of the next few months, is to really bring these concepts that we've developed to ground so we can really make a difference in health systems all over the world.
What role do you think that health policy and health systems research has in making health systems more resilient and more responsive?
Well, what we're doing now at the Rockefeller Foundation is running a bunch of pilot programs in different countries around the world and cooperating with some global organizations like the World Bank, UNICEF, and others on this to test out the concepts. And I think that's really the next step, is we've got some ideas, we've got some initial learning, well, let's go try it out in a few places. And those will provide the kinds of case studies and the experiences that we need going forward. What Health Systems Global can do as the backbone, kind of the research backbone for all of us doing work globally in health, is to study this. Help us identify, some of the numbers that we need to be looking at of moving the dial from 0 to 10. And it's that kind of research that's needed, and that's what we've been seeing this week in Vancouver, is academics, people who run programs on the ground, working together to figure this out, and that's what we need to do going forward.
Well, it seems like there's going to be some direct change coming out of this conference.
I think there will be change coming out of this conference, and let me just say something we've learned at the Rockefeller Foundation about resilience. When we work on resilient systems, whether it's resilience to climate change, to economic downturns, to refugee flows, or to health, that when we focus on building resilience in those systems for times of crisis, we find that those systems actually then function better also in times of calm. It's kind of a resilience dividend that comes out of building resilience.
It's really interesting. Well, thank you so much for your time.
You're welcome. Glad to be here.
Thank you.